Good morning, South Africa. We are here in Randfontein this morning together with my president of ActionSA, Herman Mashaba, together with Team Fix SA member Solly Moheng for International Relations, as well as Dr. Kgosi, Team Fix SA member for healthcare. The purpose of us being here today, we all remember in 2015, 2016, the tragedy that hit our country, that hit South Africans, that left us speechless. Life Esidimeni, a tragedy that claimed the lives of 144 people, 144 vulnerable persons that to date 44 of those people remains unaccounted for. Today we are unpacking the National Health Insurance Bill, and we are saying this is another tragedy in waiting, another Life Esidimeni in waiting. To unpack this matter this morning, I'm going to allow for my president Herman Mashaba just to take to the floor and explain to you what we are actually highlighting here this morning. Thank you so much, President.
Thank you very much, Dereleen. Thank you very much also to Team Fix SA members for health, Dr. Kgosi Letlape and Mr. Solly Moheng for international relations. Fellow South Africans, we read a very sad venue this morning, a venue recommended by Dr. Letlape that we actually come here to demonstrate to you people of South Africa the impact of NHI, which might really end up being another Life Esidimeni. I was actually quite surprised this morning arriving here when Dr. Letlape says to all of us to say this place a few years ago was called Life Esidimeni. I see they've now rebranded it, call it Randfontein Recovery Center. Just really change the name. I think obviously Dr. Letlape will be the one to really actually unpack this matter properly as a medical person, someone who actually has got a lived experience of the tragedy of Life Esidimeni. So for me, honestly, I don't really have the words to describe how I feel about what happened a few years ago to our fellow vulnerable South Africans. I don't really believe one can have enough words to express how I feel, though obviously I'm here with a broken heart and really hope that you fellow South Africans please heed the call of the experiences of what Dr. Letlape is going to share with you, because come next week Wednesday you've got to really decide whether this current government continues with what they did a few years ago with Life Esidimeni, with this NHI which the president signed without actually giving consideration to the technical side of what needs to really happen to our national health as a country. So thank you so much. I think this morning is Dr. Letlape to really, as a professional medical doctor who lived this experience, to really share with us what happened and what is likely to happen in the event of NHI becoming law in this country. Dr. Letlape, the floor is yours.
Thank you, Mr. President, and thank you to Team ActionSA for the support. You know, I wrote an opinion piece for the Times over the weekend, and the title was "The Road to Hell is Paved with Good Intentions." When you go back to 2015, the Life Esidimeni tragedy, there were good intentions of deinstitutionalization, taking people closer to where they live, small centers that will provide care. But despite that good intention, the execution was disastrous. Something that would serve society was taken for people to make money out of. So the way in which it was done was basically motivated by greed, by profit. Institutions like this are key to healthcare delivery in this country. They've always been there. Life has run nights hospitals for infectious diseases. So there'll always be public-private cooperation. There'll always be some private provision that is paid for South Africans by the state. As an example of the contract with Life Esidimeni, where when we come here, we don't pay, the state pays. So this is an example of how national health can be done, taking advantage of existing platforms. Now, the policy of deinstitutionalization, which is a sound policy, as the Health Ombudsman reported, was done in a destructive manner. It was done hastily, it was done shoddily, and it basically turned out to be one of the most harmful occurrences of our democracy. You know, sometimes people think about what happened in Marikana, but what happened here makes what happened in Marikana pale into insignificance. Here you had vulnerable people that were removed without their families being fully informed. Over 1,700 patients were removed. 144 of them died. To date, 44 have not been accounted for. That is a tragedy of immense proportion. Now, what that tragedy illustrates, it's political interference, political impunity, and how political interference can harm services. This process was led by the then MEC of Health in Gauteng. From a properly functioning institution, people were taken to NGOs that had no capabilities. Effectively, tenders were issued to friends who were not capable of delivering the needed services. Something not dissimilar to what this government did with COVID funds, where people that could not tell the difference between a syringe and a gauze were given contracts to supply PPE during COVID, with disastrous consequences, with the SIU being involved. Now, you can see the parallels, but a national health system is what we need. But money is not our primary problem. Now, if you wanted a sound NHI, you would do it and base it on improving what we have. The key to implementing a successful national health system is to fix what we currently have. Now, we currently have two tiers: public health system and those on medical aid. And both of them come from government. The Medical Schemes Act is an act of parliament. Public health is funded through budgets from our collective efforts as South Africans, from the taxes that are collected. Both of them are sick as hell and need to be fixed. Ironically, in 2015, the Minister of Health, Aaron Motsoaledi at the time, commissioned a health market inquiry to look at why our private health system or our privatized health system is not performing as it should. That commission was led by our previous Chief Justice, Sandile Ngcobo, with a panel that was highly qualified for the task. They gave recommendations, 2019. To date, those recommendations are gathering dust on the shelf. They are not being implemented. So the way we build a national health system for all is to implement those reforms. If you are going to have a tax-like funding, you do not create a third tier you call NHI. You reform the Medical Schemes Act. Remember, the Medical Schemes Act is where the president gets his health from. PARMED is a medical aid for parliamentarians. The judiciary, they are all on medical aid. The executive is on medical aid. Parliament is on medical aid. All our houses, provincial legislatures, they are on medical aid. If you want a national health system that will work, you reform the medical schemes. You do not create a low-cost medical scheme that you are not a part of. You know, when they come up with this medical scheme, they are going to continue with their medical aids. Creating a fund, 200 plus billion rands, that they do not belong to. Recreating admin structures that bypass current structures that we have, like the Council for Medical Scheme. If you have no ill intent and you want to build on the knowledge that we have, why would you not build on what we have? Why would you not make the Council for Medical Schemes reform how they work to ensure that those on medical aid have universal health coverage for no payment at the point of service? That if you are on a medical scheme, there's equalization. There's risk equalization. So anybody that produces a medical aid card will get the same care from all providers that are prepared to provide those services. But no, what do? We create a fund, we give powers to a minister to appoint a board that is parallel to a competent functioning board that has 57 years of experience in managing health funds. You leave it aside. You're going to have a board appointed by the minister that now is going to duplicate functions that are being done elsewhere. Part of the things that have been put on that bill is that that board, the NHI, will now accredit healthcare professionals. Now, healthcare professionals are already accredited by the relevant statutory bodies. I'm accredited by the Health Professions Council. There's a Nursing Council accrediting nurses. There's a Pharmacy Council accrediting pharmacists. Why are you now creating some people that don't have the skills to do what is already being done? Now, exactly like Life Esidimeni, where you took vulnerable people from a competent institution to self-appointed friends without capacity, resulting in massive deaths. 144 people dead, 44 not accounted for. Dismantling something that functions, taking it to friends that don't have the capability, and nobody accounts for that. Now you have systems that work. They are sick, they need to be restored, they don't need to be cremated, and you create a dead body from beginning. I mean, if there are good intentions, why don't they start with themselves? There are no good intentions. This is the road to hell. If you think COVID was a disaster, NHI is a monumental disaster. If you think what happened with Life Esidimeni was a tragedy, what is being envisaged with this fund will make all this pale into insignificance. There's nothing wrong with the national health system, but don't take us to hell. If you're taking us to hell, at least have the courage to be in the first courage. Start with yourselves. Ask yourself. They are on medical aid. They are creating an NHI. And in that document, they say to you, it will never be fully functional for at least 6-8 years. It will only function 2030, 2033. Do you know what that means? You are going to vote for something that will not be functional for the full term of the next government.
Wow.
But they will be collecting the money. Where do you think that money is going to go to? I mean, they are so brazen that they will collect the fund and they're telling you, we don't have to deliver for 8 years. You're going to get nothing for 8 years. And what you're faced with, a challenged public healthcare system, a challenged medical scheme environment, will go unabated. Because remember, for them, when the medical aids don't work, they get onto official planes and go for care overseas. I mean, one of our presidents used to attend outpatients department in Russia, not here. That's what they will do. Now, how do we get excited about something that in that document it's written it won't work for the next 8 years. If you put ActionSA into government, reform of the healthcare system starts on the 30th of May 2024, not in some too distant date when all the money will be taken out. You know, I'm a healthcare professional and we need to wake up. There was something called a certificate of need that was in the National Health Bill, and we fought it, and President Mbeki could never sign it. This is a backdoor for a certificate of need. The people that run this fund will decide which doctor practices and which doctor doesn't, which private pharmacist practices and who doesn't. And where do you think those contracts are going to go? And who are going to be the biggest casualties? It's those that serve the vulnerable populations. Because let me remind you, pre-94 under medical aid, there was this negotiated scheme where if you are on medical aid pre-94, you had what is being envisaged for NHI. Care was guaranteed to you. Without this package, we cover the front tooth, we don't cover the back tooth. What you need was guaranteed. And if a practitioner was willing to take the tariff that has been negotiated, payment to that practitioner was guaranteed. And you had to participate voluntarily. If you were registered by the relevant statutory body that qualified you and you were prepared to take those rates, patients could come and see you. Under this scheme, none of those criteria will be used. It will be a committee that decides who's needed, who's not needed. It will be pick and choose. And if you are not chosen, you'll have to be on SASA. Because it means you can't practice your profession in your own country. You can't see the patients that you were seeing. Because now everybody has been put under NHI and only a select people will provide services. Cronyism, bribery, that's what has been signed into law by our president, Cyril Ramaphosa. I'm personally disappointed that we're not being listened to. And people have to understand this, you know. Throughout Africa, majoritarian governments don't work. Because what they do, they lie to you on campaigns, you elect them, and if they are a majority, they are not accountable. They do as they please for 4.5 years, and a month before the election, they come and tell you sweet nothings like NHI. And because you don't have, you believe them. Look at their track record. You know, when you are a woman sitting in a marriage where you're being beaten up by your husband, and every time he comes back, gives you sweet nothings and beats you up again, you need to get out to survive. This is what the ANC has done to us. And we need to get out to survive. I understand the issue where, you know, that husband will be the only breadwinner and you got nowhere to go. But we need to wake up to the fact that with leaders like Herman Mashaba, there is somewhere to go. We cannot keep saying, oh, they've been terrible, but there's no alternative. Then there's something wrong in our heads. We are like the battered wife. We understand, but we do not accept. Nobody is God. And we need to judge people on what they have done before. Because they will keep doing that.
Yes.
And that's what you should expect. So the NHI is not going to sort out our problems. The NHI is not going to give employment to the unemployed healthcare professionals. We have doctors that have studied hard. They were sitting outside the department in KwaZulu-Natal for a few weeks. It was raining on them. They've been asked to apply. Ispani Sami. Where's the money going to come from? when the money is being looted. Now, there are three principles that you need to take from ActionSA in terms of health. The first issue is revitalize the public sector, professionalize it, insourcing, get rid of tenders. Tenders don't work. Tenders have turned out to be legalized corruption. You must insource. I mean, they create this board, they create this NHI, suddenly the investment fund of that union of theirs will be the administrator of NHI. Nobody's talking about curbing administration fees. Do you know how many tenders are going to be issued between now and 2030 when you have no change in the healthcare system? But there'll be billions and billions of our monies flowing out. When they will be sitting pretty under the current medical aids and getting their care. That is not what a national health system is about. If it is national, it has to be for all of us from day one. If it is national, it has to deliver from day one. Section 27 of the Constitution talks about progressive realization of health within available resources. Collecting money and saying it is going to work in 2036, 6-7 years' time. There's no progressive realization. It's destructive procrastination. And people will be dying as you procrastinate. But you wouldn't care. You'll be getting your care from the private clinics or from your overseas medical safaris while the people suffer. There's nothing wrong with a national health system concept. We embrace it. There's nothing wrong with deinstitutionalization as was envisaged. But the way Life Esidimeni was done is not the right way to do. What the president signed Wednesday a week ago was to bring to life and to nationalize the Life Esidimeni Tragedy. Not on our watch.
Yes.
We will stand up to that. And it's not about the majority you get. It's about making sure that South Africans are educated.
Yes.
You know, when we have state capture, somebody spoke about connecting the dots. We now have health capture. And our duty is to ensure that South Africans wake up to connect the dots. And you must tell the president that, President, on the 30th, I'll go with you to where you get your health care. That's what national health means. And that's what the system that needs to be implemented from the 30 years, not the crookedness that has become legal. You know, the president said, oh, NHI, I've signed, it's now law. And I need to remind the president, the fact that it's law does not mean it's right. The fact that it's law does not mean it's ethical. Apartheid was the law, but it was not ethical. The occupation of Gaza is the law from Israel, but it is not ethical. The fact that it's the law means you are a bully, you are in power, you are not serving society. And that can only be changed by how we vote on the 29th. Make sure that those that gave us this privilege of voting stop turning in their graves. We need a South Africa that unites us all. A national health system has to be for all of us from the first day. Just like ActionSA represents the demographics of South Africa from the day of inception. Thank you.
Once again, I'm standing here and I'm so proud to be a part of ActionSA. I am so grateful for the leadership of this party, but I don't want to talk too much. I'm going to hand over to Solly Moheng, who is also Team Fix SA member for international relations. Thank you so much.
Thank you, Dereleen. Thank you, President Mashaba, Dr. Kgosi. I'm really excited to be here. We're here, actually, fellow South Africans, less than a week before the next the general elections in South Africa. We could have been elsewhere, This country over the past 30 years has accumulated lots of wounds, and this is one of the wounds, festering wounds over which they keep putting plasters. The rebranding of institution is one of those plasters. It's no longer that thing that reminds us of the bad things we did. It's something else. But we need to move away from 30 years of shortcuts. A government that takes shortcuts just to get more of their colleagues enriched, to a government that gets things done. And some of the things that need to be done will take time, and we must accept that they must take time. But they must not take time at the expense of. The shortcuts must not be done at the expense of the integrity of life in South Africa, of the people of South Africa. We can mention Marikana. We've just spoken about Esidimeni. There have been buildings in Johannesburg and other cities that caught fire, after which, some of the casualties turn out to be people who came from elsewhere, who could not be identified. There was another accident in George recently with a building that collapsed. Some of the people who burned and died in that building, are not able to be identified. We need to have a government that understands the need to really do what is good for South Africa, for South Africans, create opportunities and laws that are followed not only by people in power, but by people in the employment sector around the country. People who employ those who cannot be identified when something goes wrong with them cannot be trusted to continue running this country. So, my fellow South Africans, actioners, and President Mashaba, this is really just to say to you, this is just one of the wounds. South Africa is almost like a bucket which is perforated, fully perforated, and this is just one of the holes. Where do we stop plugging the holes? So Dr. Letlape, they won't be collecting funds for the next 8 years. It's not going to happen, because South Africans are going to trust ActionSA to come in with action to make sure that funds are not collected for 8 years with no action being taken. And I'm really proud and happy to be part of this team. Thank you very much.